My name's Aryan Tavakkoli. I'm Medical Director of Quantum Clinic in East Sussex. My clinic, like the Barnard Medical Centre, is completely plant-based, so I have nothing animal-based in my clinic. Anyone who is employed at Quantum Clinic is also required to respect the plant-based ethos whilst on the clinic premises. So I'll give you a bit more background about myself later on. I think my title is the longest in the whole day. It was quite difficult to encompass everything that I was intending to speak about, and as I was preparing my talk, I very quickly realised that actually I can't talk about everything I had intended to, so I apologise. I've actually removed some of the items that you might see in your programme. So I'm just going to cover what these different areas of medicine mean, and also why doctors might even consider leaving the NHS to perhaps encompass a more comprehensive approach to medicine. Why would we even do that? And then just to illustrate how my practice has changed since opening my own clinic, I'm going to take one area, namely micronutrient status, and how I test for it and how it might benefit my patients, just to show how I do things a little bit differently now. And then I was asked to speak about my personal experience of leaving the NHS and setting up my own clinic, and I'm hoping to give some practical tips to those of you today who may be thinking of doing the same. Can I just ask, how many in the room are health professionals? Oh, quite a lot. Okay, that's great. And how many of you are thinking possibly to branch out either completely or part-time away from the NHS to do something else? Quite a lot. Okay, so I'm looking forward to hopefully giving you some tips. Let's just start by thinking, why would doctors even think about doing this, about leaving the NHS, which after all does provide a permanent and secure income and job? Well, we all know that burnout is very common amongst healthcare professionals. Even though we may love practicing medicine, it can be really difficult to practice medicine in the current circumstances, and it can lead to a lot of job dissatisfaction in many areas, and one of those is little time with patients, which then can be very difficult to discuss everything that you want to discuss in depth. I mean, it's not impossible, of course it can be done, but it can be difficult to discuss in depth everything that you feel may be important, such as nutrition and lifestyle, in the limited time that we have. Mental and physical stress is very common amongst healthcare professionals because we work very hard. And, you know, at the end of the day, we may not always experience the personal rewards in terms of personal satisfaction or patient satisfaction. So that was me after 25 years in hospital medicine. When you open your own clinic, one of the main benefits is that you can spend as much time as you like with your patients. So my consultations now are at least an hour long, often longer. During that time, I can discuss whatever I like with my patients in great depth. And even more importantly, they can tell me their story and they feel heard, and that's so important. So in the end, I feel personally much more satisfied because I feel I'm delivering a service that is the best that I can deliver. And my patients feel more satisfied because they feel that they're seeing a doctor who really has the time to address their needs. So that's me now, and hopefully my patients. My background is that I'm a respiratory physician. I opened Quantum Clinic in East Sussex just under 2 years ago. And whilst I'm still on the specialist register, I still have to undergo appraisals, revalidation, CPD, everything that other doctors undergo in the UK. At the same time now, I'm able to offer a great deal more to my patients than I would have been able to offer in the NHS. So during my hospital years, I got myself trained up in a lot of different disciplines. I trained in traditional Chinese medicine, in acupuncture, in herbal medicine, more recently in functional medicine, in hypnotherapy, and a few other areas that interested me. So I have a lot of tools that I can use. I don't use all of those in my current practice, but I do use a lot of them. And so they're things that I wouldn't necessarily have been able to do in my NHS practice. Up until now, I've been seeing people with all kinds of chronic illnesses, but my main interest actually is cancer. And there's a lot that we can do, a lot more that we can do to support people with cancer. There's so much that can be done. And I'm really happy to say that after a lot of hard work, which is still ongoing, my new integrative cancer program is going to be launched in a few weeks' time, and I'm really looking forward to that. But I'll tell you more about the practicalities of setting up a clinic towards the end. First of all, I just want to go through these different areas: lifestyle medicine, functional medicine, integrative medicine. What do these all mean and how do they interrelate? Well, one of the first things to say is that all of these areas have lots of different educational establishments, and they all have slightly different training programs, different qualifications, and there isn't really a standardized uniform definition used by everyone. So, for example, the British Society of Lifestyle Medicine says that this requires an understanding and acknowledgement of the physical, emotional, environmental and social determinants of disease. And the American College goes a bit further into more detail, brings in the predominantly whole food plant-based diet, regular physical activity, addressing stress, sleep, etc., to prevent, treat and often reverse lifestyle-related chronic disease. Now, I've spoken to the chairman of the British Society of Lifestyle Medicine recently, and I know that last year in 2018 there were 40 diplomates in the UK. This year there are 80 signed up, so it's already doubled in the space of 1 year. But that's just healthcare professionals actually taking that diploma in the UK. I know that there must be many, many more doctors and healthcare professionals practicing lifestyle medicine in some way in their practice today. Functional medicine, again, many educational establishments. The IFM is probably the largest, and they define functional medicine as a systems biology-based approach that focuses on identifying and addressing the root cause of disease. That's essentially what functional medicine is. It's looking at the underlying factors, the underlying issues that may have caused disease to arise in the first place. The British Society for Ecological Medicine is the same as functional medicine. That's the term we use in the UK for functional medicine. Has been around since 1983, so they've been around for a long time. And they say that ecological or functional medicine is firmly rooted in the science of conventional medicine and recognises the importance of both external influences, so nutrition, environment, lifestyle, and internal influences, so gut bacteria, genes, nutritional deficiencies, biochemical disturbances, etc., in causing disease. So you can already see that there's some overlap between functional medicine and lifestyle medicine. And integrative medicine, we will get through these boring definitions very shortly. Integrative medicine, this is the definition by the Royal London Hospital, that integrated medicine brings together conventional medicine with safe and effective complementary medicine, emphasises the doctor-patient relationship and the use of all appropriate therapeutic approaches. My preferred definition is that it's the practice of medicine which seeks to identify the best solutions for the problem by using both traditional and non-traditional therapies. And there's a third definition there as well. So there are a lot of similarities with these different approaches. They all are patient-centered rather than disease-centered. They all aim for personalised treatment for the individual rather than just a standard protocol for everyone, for example, with asthma or rheumatoid arthritis. The treatment's aimed at removing the underlying causes, not just treating the symptoms. It's a very proactive approach, so preventative and dealing with underlying issues as opposed to just reactive, meaning just dealing with the symptoms when the disease is diagnosed. The focus is more on non-pharmaceutical approaches that have a low risk of side effects. And the focus, again, is mainly on lifestyle, nutrition, and environmental exposures. So there are a lot of similarities, and there is a huge amount of overlap. And I haven't even begun to discuss all the other kind of areas of medicine that are practiced. So holistic medicine is a very broad view. It could encompass all of these. There's mind-body medicine, there's naturopathic medicine, there's environmental medicine. Complementary and alternative medicine, just to define the two, if a non-conventional therapy is used together with conventional treatment, it's termed complementary therapy, complementary medicine. If a non-standard or non-conventional therapy is used instead of conventional treatment, then that's alternative medicine. If you're interested to know more, I've got a blog on my website called Root Cause Medicine is the Best Medicine. My website is quantumclinic.co.uk. And that blog provides a table with the differences between conventional medicine and functional medicine, but you could easily remove functional medicine and replace it with lifestyle medicine or integrative medicine, and it would read in a very similar way. So just to go on to illustrate one area of my practice that's changed since I started to embrace a more comprehensive view in my practice. Micronutrient status. We've heard a bit about micronutrients earlier today. So they are the elements or chemicals in our body that are required for cellular development and growth. They're called micronutrients because we only need tiny trace amounts, not much of them. But nevertheless, even though we need tiny amounts, a deficiency can lead to very dire consequences. So globally, the main issues with micronutrient deficiencies are with iodine, zinc, vitamin A, and iron. Iodine is quite possibly the single largest preventative micronutrient deficiency that causes brain damage that can be prevented. And vitamin A deficiency, of course, causes acquired blindness. Now, we all know that micronutrient deficiencies are more common in countries with low incomes and with poor dietary diversity, but actually there's quite a lot of micronutrient deficiency in our society that isn't well recognised. So this is data from the UK National Diet and Nutrition Survey, and it wasn't terribly large. It was over about 3,000 adults, and their nutritional intake was studied. The micronutrients were analysed. This is with food, excluding supplements. And this is data in women aged 20 to 59. And it doesn't show up too well, but, oh, sorry, wrong one. Just in this area, you can see that there are several deficiencies noted in this age group, and that includes calcium, iron, magnesium, and iodine, which is very much the kind of picture that I'm seeing in my practice. So what are the consequences of micronutrient deficiencies? Well, there are lots of studies, there's lots of data on different micronutrient deficiencies and what kind of conditions they can increase the risk of or what can develop. But I've just put up a few studies focusing mainly on cancer. And we know that with this top meta-analysis that low dietary zinc intake increases the risk of pancreatic cancer. That's a meta-analysis. Another meta-analysis showing that toxic copper levels increases the risk of lung cancer. So that's not a deficiency of copper, that's actually toxic levels, but it does reflect the importance of knowing the levels of micronutrients. And in this meta-analysis, higher magnesium intake was associated with a lower risk of colorectal cancer. And this one, we all know that vitamin D is so important. We've heard about it several times today. Vitamin D deficiency is associated with numerous chronic conditions, and we know that a load of vitamin D is also a risk factor for developing cancer, in this case breast cancer. But here's the thing. How do we know what our patient's micronutrient status is if we don't check it, if we don't test for it? And the next question for me is, if we then identify a micronutrient deficiency, would replacing that either through enhancing the diet or through supplement means, would it change the outcome of that particular condition? Well, in the case of vitamin D and cancer, we know that answer because we have data to say that improving the vitamin D level does improve outcomes in cancer. But in the case of a lot of the other micronutrients, we just don't have the studies to show that. And the other thing is that there can be risks to taking supplements. So some supplements have been shown to actually increase the risk of developing certain chronic diseases. For example, people with very advanced cancer, there are studies to show that taking folic acid supplements can actually increase the speed of the spread of cancer. And there are other studies showing that some supplements can cause more harm than good. We have to be careful with possible interactions between supplements and drugs or supplements and other supplements. And also it's important to remember that the supplement industry is a very large industry and it's unregulated. So if you think of all those thousands and thousands of bottles of supplements on the supermarket shelves, it's actually a bit of a scary thought. And actually that includes well, I'll come on to speaking about synthetic supplements in a moment, actually. So it's an unregulated area, and I would certainly agree with this study that looked at taking supplements in different conditions and found that taking supplements of vitamin E, A, C and D and folic acid for prevention of disease or cancer is not always effective and can even be harmful to health. So it would be rational to limit these supplements to consumption to those having deficiencies of the mentioned vitamins. So I agree that it's important to test for micronutrient deficiencies and then to address if they are actually found to be deficient. But there's, you might think after what I've said that I disagree with taking supplements. Actually, I don't. I do use supplements in my practice. I used to be of the opinion that we could obtain all of our nutritional needs through a healthy diet. But I have to say that with all the nutritional testing that I do, and I do this on 100% of my patients, I see micronutrient deficiencies time and time again, in fact, all the time. So it really has changed my view on the use of nutritional supplements. Of course, I think we all agree that it would be ideal to attain all of our nutrition through a healthy, whole food, plant-based diet. But the fact is that there are a lot of people with micronutrient deficiencies, and a lot of those deficiencies may have led to the development of chronic conditions in the first place. So it is important, in my view, to identify micronutrient deficiencies and to address those with whole food-based supplements. So just before coming into talking about synthetic and whole food, one important thing about the studies, on pretty much all the studies on supplements, is that they do not distinguish between synthetic supplements and whole food supplements. And that is a very important distinction to make, in my opinion. Synthetic supplements are basically isolated nutrients. They're isolated through a chemical industrial process, and you just get that single nutrient, whatever it is, calcium, magnesium, whatever. And we've already heard some data on the dangers of taking, for example, calcium and cardiac effects. And I mentioned about the folic acid and advanced cancer. Whole food supplements are derived from concentrated, dehydrated whole foods. So when we take whole food supplements, we're not taking an isolated nutrient. You're actually taking the full gamut of vitamins and minerals, plus the cofactors that are required for that nutrient, or for those nutrients to be utilized by the cells. So the bioavailability will be completely different. Now, all of the studies that I've looked at on supplements do not distinguish whether they're using synthetic or whole food supplements, but I'm pretty sure they would be using synthetic supplements. And I think that is a very different picture when you use whole food. So that is the ingredient label of one of the whole food multivitamins that I use currently. So all of these vitamins here on the right are derived from cruciferous vegetables, and a blend of vegetables and fruits, so carrot, spirulina, alfalfa, artichoke, beetroot, etc., etc. It's basically like eating a loaded plate of fruit and vegetables. It's very different to taking synthetic supplements. So I can't prove this because I can't state any studies, but I suspect that the negative effects that we have been seeing in those studies, for example, with the calcium associated with higher risk of myocardial infarction, etc., is with the use of synthetic supplements. That's my opinion, but I can't prove it because we don't have the studies. What I can say is that in my personal practice, what I do is I test for micronutrient deficiencies, and I'll show you how in a minute. And if I do find any, then I target those with appropriate dietary advice and also with whole food supplements where necessary. So talking about testing, the top tests are those that are available to us in the NHS. And there's probably a few more depending on individual scenarios. For example, we can check for copper levels as well. But there's a whole range of nutrients that are not routinely tested for, and even these are not always routinely tested for. I see a lot of people with cancer who've never had a vitamin D level, even though we know that vitamin D level is so important to know about in terms of improving the outcome. So the testing that I do currently, what the lab does is they look at the metabolic pathway of different nutrients, and they look at the downstream metabolites. So once that nutrient has been used, let's say it's vitamin B12 or magnesium, once it's been used by the body, it will create certain metabolites, and those are called biomarkers. And the biomarkers is what the laboratory measures. And by measuring those biomarkers, it gives me a view of how bioavailable that particular nutrient has been to that person's system. So, for example, this is one page out of a 20-plus page report that I'm provided with, and they'll tell me about the levels of vitamins, minerals, amino acids that you'll see on this page. So it doesn't come out very well, but you'll see all of the essential and non-essential amino acid levels. This section I find particularly helpful, dietary peptide-related markers, because if I see that someone has a high carnosine level and a high anserine level, then I know that that individual has had a high intake, a dietary overload of animal-based proteins. And it's very useful, it's very helpful for people to see this in black and white, because if they see that, then they'll be more open to my recommendations going forward. This is a page on essential fatty acid markers. So we've spoken about essential fatty acids earlier today. So I can see their, omega-3 fatty acids, omega-6s, etc., in quite a lot of detail. Another useful thing I get from this test is the toxic element. So mercury, for example, I not uncommonly see an elevated mercury level, and then that leads to a discussion with the patient regarding the possible exposures for mercury, which often comes down to eating seafood. So again, it's very helpful for people to see this in black and white. It's not elevated on that test, but I often do see it in the red there. Because when people see this, then again, they're more open to the dietary changes that I go on to suggest to them. I would love to talk further about all the tests I use, the functional medicine laboratory tests, because I've really found them to be so immensely helpful, and it really has changed my practice with my patients. So there are tests checking for example, how we excrete our hormones, so in particular for people with hormone-sensitive cancers, such as estrogen receptor-positive breast cancer. It's important to know if they are excreting their estrogen, or if in some way their detoxification pathways are not functioning properly, so the estrogen's just recirculating in their body. That will be no good for someone with a hormone-sensitive cancer. So some of the tests I do will tell me if the estrogen detoxification pathway is working well, if they're able to excrete their estrogen, if they're able to methylate their estrogen, which is another way of metabolizing it, and many, many other tests. I use a stool test to look for the gut microbiome, which we all know is terribly important, to look for the gut defense mechanisms, etc. There are so many things that can be identified on functional medicine testing. These are all validated tests. They're performed in specialized laboratories by highly trained technical staff. Unfortunately, they're not available on the NHS. I wish they were. And it does mean that they can be pricey to undergo functional medicine testing. However, for the people that I've been seeing, the results of those tests have really made a dramatic difference to managing their condition. So I've got to stop talking about testing there, and I'm going to go on to practical tips of setting up your own clinic. So I'm sorry that the talk is a bit disjointed, but when the limited time I have left, I need to cover this. So when you're thinking, or if you're thinking of branching out, as I did, it's really important to get your reasons very firm. What is it that you want to achieve that you don't feel you're currently achieving in your current place of work? And it's really important to think about the costs before you start, and to have some sort of contingency plan. If you have a lot of contacts, and if you already have a lot of potential patients, well, that's wonderful. But if you're moving into a new area of medicine, or even moving location into a new physical location, then you're going to need some time to build up your patient base. That might be 6 months, it might be a year, it might be 2 years. It might take quite some time to start earning an income from your new practice. So during that time, you need to be able to support yourself to have an income. For me, that contingency plan meant going back to the NHS and doing some locum work on and off for the first year and a half. You need to remember that when you set up your own business, you no longer have an employer to pay for your annual leave, your sick leave, etc. You need to take care of all of those costs, including the cost for appraisal, revalidation, professional fees, and everything else. So my appraisal costs every year are £700 just for the appraisal. It's not a cheap process, and that's not including all the other costs. So it's really important to think about the costs in advance, and preferably to have some sort of cash flow forecast. Think about your location. So you've got various options. You can have a rented room, you can convert part of your own home into a clinic, share a space with colleagues. What I would recommend with all of these is that you look up the Care Quality Commission's requirements for premises before going ahead. And just bear in mind as well that if you have your own space, your own clinic, you personally will be responsible for everything. So aside from the medical side, if something goes wrong with the printer, you need to fix it. If something goes wrong with the plumbing in the toilet, you also need to make sure that that's fixed. So everything comes down to you. Talking about CQC, it's important to know that until CQC have inspected your location and have given you permission to go ahead, it's illegal to start seeing patients independently. You have to wait for CQC permission. But the thing is, they won't inspect your location until you're ready and set up to go. You have to be completely ready. So your website has to be up, they'll ask about your website, your phone system has to be up, your clinical services such as clinical waste collection, everything. If you're employing staff, you need to show that you've gone through the process. So you basically need to be ready as though you're about to open tomorrow to the public. So therefore, I highly recommend getting the advice from a CQC consultant. There are companies who provide advice on getting through CQC inspections, and I recommend that you contact one of them and read up everything that you can on CQC requirements, because it would be a bit of a disaster if you went to all that trouble, finances, effort and everything, and then just have CQC turn around and say, well, actually, you can't open now. And that would set you back maybe a few months. So choose your advisor wisely. There are some companies out there who charge an awful lot of money to provide advice, and they're not all as good as each other. So look carefully, but I do recommend that you get advice from a CQC consultant. To employ anyone, such as admin help, you're going to need to read up on your employer responsibilities and your legal duties. You'll need employer's liability insurance. You'll need to think about your staff training and appraisals, etc. You'll need to register with the Information Commissioner's Office. You're your own employer, so you need to maintain your own CPD, make sure you keep up your appraisals, and I'll talk about a body who can arrange that for you shortly. Make sure that your medical indemnity provider can still cover you, because if you change your scope of practice, then they need to know about it. So previously I was with the MDU and then the MPS. Both of them refused to cover me when I changed my scope of practice and moved more into functional medicine and integrative medicine. So I had to find another company. So do speak with them and make sure that you'll still be covered. And it's really helpful to establish links. So find other healthcare professionals who share your vision and your interest. You'll need to look for private labs for blood tests and other testing. Look around in detail, do your research well for supplement companies, because there are a lot of supplement companies out there, but it does take a lot of time to find companies who can, for example, provide you with a third-party certificate to prove that the supplement contains what they say it contains. Not all companies will do that, but if you know that your supplement company is prepared to do that, then they're a good one. You know that they're reputable. And various other things. You'll need some clinic software. You'll need to make sure that you're compliant with data. If you have a good CQC consultant, they will help you with most of this. These are some organisations that I found very helpful. So the Independent Doctors Federation help or support doctors who are working independently. They can provide, so they're a regulatory body for your revalidation, and they can set up your appraisals for you. Let's Do Business is a business group that can help with financing things like equipment for startup businesses. Blue Stream Academy sorts out online training, so this is for mandatory training for yourself and your staff members, things like fire safety, infection control, manual handling, that kind of thing. And MyRuby is a virtual receptionist service, so if you don't have the funds right at the start to employ some admin support, you can set up a virtual service, and that's still very professional, and I found them to be very, very flexible and professional, and can recommend their services. I've certainly found that to be true. And often when we want to grow and develop and move into new areas, we need to move out, or in my case, leap out of our comfort zone. And very often over the last couple of years, I've lost count of the number of times I've said to myself, how am I going to do this, every time I've been faced with a challenge. In fact, I did that just a few weeks ago, metaphorically speaking, of course. So, but you know, if you follow your heart and you're offering the best service that you know you're capable of offering, on the other side of that wall can be great satisfaction, great fulfillment. You decide how long you spend with your patients, you decide your hours of work, you decide your days of work, you decide the content of your consultations, and it brings much greater fulfillment because you'll be able to practice the medicine in the way that you wish, of course within the regulatory confines. So I'm delighted to say that with a lot of hard work, which again is still ongoing, I am actually finally living my dream. And I wish the best to any of you who decide to take the leap and do the same in future. Thank you very much for listening to me.